Hello, I'm Dr. Keya. I'm Gynaecologist and Obstetrician at Aster Clinic Business Bay. I'm going to give some information regarding PCOS, that is Polycystic Ovarian Syndrome. It is the most common systemic metabolic disorder which is seen in the reproductive age group women between the age of 15 to 44. And it is almost the incidence is 10%. It is the most common reason of anovulatory infertility. If there are three features out of which the two are present, then the woman is labeled as a polycystic ovary. The first is different and difficult period pattern. If there is amenorrhea of more than 4 months, or the interval between the two periods is more than 35 days, if the menstrual cycle is, rather than having 12 times in a year, it is less than 8, then the woman can be considered that. Second is the multiple small follicles findings of more than 12 in each ovary on ultrasound, and generalized increase in the volume of the ovary, that is more than 10 cubic millimeter, and the follicle size which are peripherally arranged in the ovary is less than 10 millimeter. So these are the ultrasonographic findings. And third is the hormonal disturbance which is seen in the form of androgenic alopecia, hirsutism, centimeter obesity, and acne, plus there is infertility also half of the times. So what is the reason? As such, there is no reason about it, but there are genetic and environmental factors which cause centripetal obesity and which further causes insulin resistance. This leads to increased insulin levels in the body, which causes two types of disturbances. One is endocrinal, second is metabolic. When there is endocrinal disturbance, it causes hyperinsulinemia, which causes ovarian androgen production and which leads to anovulation and infertility, and then there is hirsutism, acne, and other features. Whereas metabolic disturbances leads to impaired glucose tolerance, and there is dyslipidemia. At times there is hypertension also. And how one can prevent this? By losing more than 5% of weight, generalized body weight. Ovulation can be reinstated in a woman, and it should be taken seriously because the complications of PCO go in the long run. Not only it leads to infertility and diabetes, but also it leads to hypertension, metabolic syndrome, and patients are at times suffering from anxiety and depression, and cancer endometrium also.